expired drugs, delayed drugs, no drugs, essential drugs 0, most essential drugs 0. This report is a serious indictment on the healthcare system in Karnataka. And let me also add, I have added the Ballari deaths to this because in the Ballari death also there was a serious breach. And let me add, amongst all the South Indian states, I think Karnataka does very poorly when it comes to maternal mortality rate, Satya.
Hi, Sudha. Good evening.
Hi.
Good evening. I had gone through the report that you suggested. I think just coming taken around or something. These figures are relating to 2016 to 2022. And these figures are also for the period of 22 to 23. So this is not a real reflection of the Congress government, which started its government from 2023 May or June. Okay. But I am not saying everything is very, very good right now from 2023 to 24. Yes, there have been problems. There have been short supplies of essential drugs. And since most of the patients who go to these government hospitals come from lower strata of the society, it is a must that the government should have all the essential drugs at least in the hospitals so that the poor patients need not go outside and fall prey to the medical mafia, the medical stores outside the hospital. In most of the categories, if you see even district hospitals or even, in taluk hospitals, more than 65 to 75% of the drugs are there. Another 30-35% of the drugs, there are some lacuna is there. But in few cases for district hospitals and all, the district hospitals can buy them locally. But the point is, whenever district hospitals or any hospital try to procure them locally, it will be more than the DGSND prices as put by the government. DGSND prices, we can procure at a much lesser price. And whenever you try to procure locally, your price will be high. That is for sure. So there is no doubt that, the present government and our Congress government, wherever there is a shortage of these supplies, we have to make sure that essential supplies are made to those hospitals. We have to do an audit, whichever hospitals are well below, if someone is saying, 50 less in district hospitals have to have 128 essential drugs and there are 55 less. I think the health department and the health ministry should go and do an audit, and wherever possible, we have to see that those medicines are there at the respective hospitals.
What is shocking is that there are major, lacunae when it comes to essential drugs, most essential drugs. There are drugs which expiry dates. There are drugs which have been delivered with much delay. 2 years in some cases it has taken. Taluka hospital, district hospitals, all of them. So the health system is in a shambles. Of course, you can say, oh, it was then the BJP government, now it is the Congress government, but I am looking at it through the prism of the Ballari deaths, where the ring lactate, the IV fluid which is given to these new mothers, which caused the death, and what deaths, multiple organ failures, etc., etc. Then the health minister says, oh, C-sections have increased, we have to decrease it, as if it's a choice made by women, Mr. Rao. I think Dinesh Gundu Rao is barking up the wrong tree, Mr. Rao. It's all in a shambles, and in a cover-up, he is running helter-skelter, Mr. Rao.
See, in the interest of larger interest cutting across all political parties, I would say that he should constitute the SIT or allow a judicial inquiry to take place, because he has himself admitted that pharmaceutical companies have gone out of control and they are literally running the system, and they have hijacked the medical industry itself. So by merely suspending the drug controller, it is absolutely not enough. This kind of corruption is going to go on. The officers here are absolutely well entrenched, and these medicines are manufactured only for government supplies. Nobody in the private sector buys these medicines. They are meant only to be supplied to government hospitals. They are of very poor quality, substandard quality, and the people who have died, they will have no strength even to come back. So Dinesh Gundu Rao should not shy away from a thorough inquiry in this matter over there. Whosoever is guilty should be punished, and they should be thoroughly be punished. And if you have seen, a couple of years ago or 2-3 years ago, medicine supplies to Gambia were halted by the United Nations because they were of very substandard and poor quality over there. Nobody went to jail, nobody was punished. Whereas if you see in Japan, Japan, one of the leading manufacturing companies, when they had an issue, the managing director and others had to step down after a police investigation, and they were brought to book over. Even within our own country, leading pharmaceutical companies like Johnson and Johnson,
Yeah.
Pfizer, and others have been punished. But why is Dinesh Gundu protecting these people under the name
No,
of only
Mr.
license?
Rao,
That is
Mr. Bhaskar Rao, Mr. Bhaskar Rao, he has of course, the company which is a Bengal, West Bengal based company, that has been blacklisted. But my question is, why is Dinesh Gundu Rao? He even yesterday said that no SIT, no judicial probe. And I
That's
do
what I
not
was
know.
wondering. It sends a very bad signal in
Yeah.
larger interest. And this is okay. I will, as Satyaprakash has very generously seen that it is across parties. I would concur with him over there. At least the system will get cleaned. Register an FIR in Bellary. Let the health department itself register an FIR in Bellary. Arrest the managing director of Paschim Bengal Medicines over there. Subject this to forensic tests over there and carry on a proper police investigation either through a SIT or a judicial inquiry. Why is he fighting shy of not bringing these people to book? That creates doubts. That doubt should not be created in larger public interest. That's
Prakash, let me come to you now. And I like the way the debate is going because we are looking at it through the prism of humanism more than anything else. Satya Prakash, I don't understand, talking about Ballari, which Mr. Rao also brought up. I don't understand what Dinesh Gundu Rao is saying that, 46% it has increased, it is now C-sections, now he is going to incentivize government hospitals to perform normal deliveries. Satya Prakash, anyone who has basic knowledge, wait a minute, knows that cesarean is not an option that I can choose. Here you see a woman, 2 cesareans. I did not have an option. I cannot give birth normally. They said your life is in danger. They cut me up. It's not that I choose it. I am saying this is, since I have read it, I have been disturbed. To say that, oh, don't do this. No one is doing it, sir. There are cases where the woman is in trauma, the unborn child is in trauma. You have to cut the woman up to get the baby out. What kind of an argument is this to cover up for the Ballari disaster and tragedy, Satya?
Sudha, first let me make it very clear that is a different issue, this is a different issue. What
No.
Mr. Dinesh Gundu said was, the normal average in a government hospital C-section is around 35%. While in all the private hospitals, it is 85 to 90%. This is a huge aberration. While the national average is around 35 to 40%. National average in private hospitals also is around 50 to 55%. But in Karnataka, the private hospitals C-section cesarean operations is to an extent of 85 to 90%, which is abnormal, is what Mr. Gundu has said. And what he said is there will be a policy to make an audit. See, he putting a mother into an OT where they give, all whatever is needed for sedation and etc. to do a surgical procedure. It puts the mother and the child under tremendous risk. All Mr. Gundu is saying is whether the doctor has taken the right decision
Of course,
or
he
the
has.
decision has been
Why are
taken
you
for.
doubting the doctor? See, my whole
I
point is,
agree.
Satya, it will go
I agree.
somewhere else. Let's focus on this. Deaths happened in Ballari. Stick to that. Look at it. Your CAG report indicts all parties here. It is not about BJP. It's about expiry dates. It's about no medicines, essential and most essential medicines, Satya Prakash. He should be concentrating on overhauling the health system. Instead, he is running hither and thither. He says, no, of course I accept, but I will not establish an SIT or a judicial probe. I accept that it is very tragic. But the point is, it's about cesarean, because only in cesareans do you require that IV fluid, because a woman cannot eat or drink for 24 hours. So he's only focusing. It's a cover up. I think instead he should be overhauling the healthcare system, which he's not doing. At first he says, I will resign. I mean, he's running a. Go ahead, Satya.
Sudha, definitely all the shortages in government hospitals have to be looked in. I'm not saying no. Why should the poor patient suffer? Another thing is, all the medicines are available, but these medicines are not available for free in government hospitals, is what the CAG report has said. And CAG report is not referring to only this year. CAG report is referring from 2016 to 2022 and from 22 to 23 also. So this report is not only with respect to this year, it is with respect to earlier years.
Come in, Mr. Rao. Do come in, Mr. Rao.
Minister, order an inquiry. Why are you fighting shy of an inquiry? Let an inquiry take place, because he has himself admitted that the medical companies and pharmaceutical companies have become uncontrollable. So this is a good opportunity for you to have a SIT or a judicial inquiry.
Right,
Let them be
right.
brought to book, as Sudha
Yes.
is correctly mentioning it.
Yes, why not? Why not do it? I mean, look, Mr. Rao, my whole point is deaths happened, then this CAG report came. When I read it this morning, like I was shocked. And my reporter also told me about it, and he said that among several other issues, this came up. Expiry date, everything. What happened was, there was a big, even initially in the Ballari thing, Mr. Rao, there was, are there IV, fluids? They are to be doubted? No, no, we will talk about it later. After that, the health minister comes out and he says, cesarean section. What has cesarean got to do? For God's sake, if I have to be given anesthesia for a tonsillitis, you see to it that they are in good shape, right? They are not contaminated. Why is it when the batch from that same company earlier was rejected, it was accepted yet again, Mr. Bhaskar Rao?
That's what I'm telling, Sudha. Let him not fight shy and try to defend. It is sending a very wrong signal. After all, whom is he trying to defend? Let an inquiry take place, guilty come out. Why is that managing director of Paschim Bengal Medical not been arrested till now? 6 deaths have taken place, the latest having taken place in Gulbarga. Yesterday morning it has taken place. Do you want to wait for some more deaths or a series of more deaths for you to wake up? Resigning, instead of resigning, let him order an immediate inquiry and take criminal action against these people. This is nothing but absolutely criminal action, and let none be defended on this count.